You guys want to just flank me in the back here? All right, well, good morning, everybody. Thank you all for coming out here. It's a little chilly. Fortunately, it's sunny. Hey, after I talk about the testing here today, I'll be making a statement regarding the in-custody death at LMDC here over the weekend. So if you could just hold on for that, we'll get to that after this. Okay, Omicron is with us. We all know that, and it has remarkable infectiousness compared to the other variants that have been out there. And once and again, it's proving why it's a real test for the world and for our city. We are recording just incredibly high daily case numbers and incidence rates that would have been unimaginable even a year ago, before the vaccines were widely available or during the height of the Delta variant. And we're just shattering records in new cases that Dr. Hartledge is going to talk more about here in a second. So the science is still early, and some people are saying that Omicron is proving to generally cause milder symptoms, but the numbers are so big in terms of case counts that unfortunately the deaths usually follow 3 weeks or so after that. So we're just really holding our breath and hoping for the best as it relates to that. But that nevertheless, this is a really frightening surge for everybody here in our city. If we have learned anything, it is to stay humble to this virus. We want to be done with it, but clearly it is not done with us. It continues to infect more and more people, causing serious damage, and then obviously up to death in the worst cases. So we wanted to adapt, and this site here at Churchill Downs is a perfect example of how we can adapt to meet new challenges that are caused by the virus with the help of great partners like Churchill Downs, one of Louisville's iconic companies, and of course Blue Water Diagnostic Laboratory. And Blue Water's been on the forefront of the COVID response ever since it started. With the sheer number of new cases that we're recording, testing has once again taken the forefront of the needs in our community. We're all aware that vaccines are readily available at over 100 different sites, but we've got to increase our testing so people can isolate if they need to and quarantine appropriately. Our Louisville Metro government was able to work with Churchill and Blue Water to get this large site up and running in just a little bit over than a week, so we moved very quickly. Starting today, this centrally located drive-through testing site will offer 4 lanes for the public, 1 for public safety agencies throughout Jefferson County, and a rapid testing line from 8 a.m. to 4:30 p.m. Mondays through Saturdays. Registration and proof of insurance or a Social Security card are required, and testing matters because you want to know, let's say you're a grandpa and you want to spend some time with your grandchildren over the weekend. Well, you would certainly like to know whether or not you're infectious before you do something like that. So it just gives you the peace of mind to regulate your movement accordingly so you can be safe and, importantly, keep those that you love around you safe as well. So people often say, how can I help with the virus? One thing you can do is get tested so you know. So no matter what, by registering and using this new drive-through testing site, you'll be taking a really critical step to reverse what is this epic surge in new cases that are happening in our community. And then obviously we ask people to wear quality masks in public, especially inside, and avoid unnecessary contact with others. If you have any questions, be sure to call our helpline at 502-912-8598, and our team can offer both guidance and connect you with resources that are out there. And then, of course, there's vaccines. If you're unvaccinated, please get your questions answered. We are still seeing people get vaccinated for the first time, so we want to encourage people to continue to do that. We can't browbeat you into that, I get that, but you're seeing how dangerous this virus is, and we just really ask people, for your benefit and the benefit of those around you, to please get your shot, and please get the 2 shots and then get boosted. I want to thank Blue Water Diagnostic Laboratory. As I said, they've been a great partner with Metro, get this site up and running so quickly. It's been really challenging for these guys when you think about the big peaks and then the valleys with the virus, but they've been able to respond and staff appropriately. It's been quite impressive. So let's hear from Blue Water Dina English.
Thank you for coming out. So we just wanted to, there were a couple of different clarifications that I wanted to make from what the mayor said. One is we have a rapid testing site, but that is reserved for the Metro employees and our K through 12 testing. So if you come to Churchill Downs and you're in the 4 public lanes, it will be the PCR test because again, the supplies are limited with the rapid, so we are reserving those for our K through 12 for the students with the test to stay. Any questions? 8 to 4:30, Monday through Saturday. And we just appreciate the patience of the public this morning. They've been so pleasant and kind, and knowing that, Blue Water too is faced with staff shortages and COVID positives. So we've had a lot of people today just be very gracious and I think one of the first people through the line did a test. I just heard this just a minute ago, and from beginning to finish it was 36 minutes from them to pull in the line and get tested and pull out. I think that's pretty incredible considering this is our very first day and we got here and at 7 o'clock this morning and we probably had over 150 cars in line already before we could even plug in our electricity. For this week, I'm not sure yet. We'd have to look at that. But we probably have already tested maybe 400, I would say. But we'll have to get you those numbers later. 48 to 72 hours. However, you most likely will get the results a little earlier. And, if you tested with Blue Water over the last month, then you know that our return times were 24 hours. But with the increase in testing, our lab is pretty inundated. So we are now saying 48 to 72 hours because we'd rather, under promise and over deliver. Well, if they have symptoms, then they need to be, quarantining and letting their employers know that they have a test and they have to wait until they get the results back. And if you do have issues with obtaining your results, please give us 48 hours before you call Blue Water because we're seeing about 300 calls a day. Just one day last week, we had 700 positives, so we have to call all those positives. In addition, we have all of the calls coming into our helpline. But if you do have a concern or request, please just email us at cs@bluewaterdx.com, and that's for our client services at bluewaterdx.com. It was pretty shocking to us, yes. Our lab director, I remember, I actually couldn't be there for his interview, but I read it later, and we couldn't believe that there were 700 positives in one day. And we're still trying to call all of those positives. No, no. And, honestly, we have not had a ton of Metro workers in yet. And so those rapids are reserved for them. And so if you're a city employee, if you'll just tell the yellow traffic guards with the yellow vest on that you're Metro, and then you can go ahead and go on in that lane 6. But if you guys wanted to reach out to me later, then we should be able to get those numbers for you by the end of the day. Right. I can't give you a percentage number on that, but I will tell you that the PCR test is considered the gold standard, and it's 99. Actually, that's going to be a question for Dr. Hartledge. So our capacity here at Churchill is upwards to about 5,000 a day, and I don't think that we'll be seeing that, but again, this virus is surprising us on a regular basis. Thank you. Yes, ma'am. When you do register, you will be asked to put your insurance in there. And then if you do not have insurance, it's okay. Just come on out and we will cover you. We got it. Okay?
So I'm not going to run through our whole dashboard this morning, but just briefly, as you know, we continue to set records with COVID case counts every day. The numbers are really unfathomably high at this point. Last week, in the last 7 days, we logged 16,287 new cases, which gives us an incidence rate of 303 cases per 100,000 of the population. And our testing positivity rate is 32%. Those are all record high numbers, and they all represent only PCR tests because of the way they're reported. So those taking antigen tests, either at home or at a site like this, those antigen tests are generally not reflected in those numbers. And what that tells us, with a very high positivity rate and knowing that there's a large volume of antigen testing going on out there, that even though our case numbers are record-breakingly high, that the actual number is almost certainly higher than that. We currently have 372 patients in the hospital, with 79 requiring ICU level of care. Those numbers are rising steadily, and although they have not yet reached record high levels, we certainly expect that they may in the coming weeks. Many people do have a milder infection with the Omicron variant. Certainly that's not everyone. And with the volume of cases, even a very small percentage of those people requiring hospitalization would lead to a large number overall. We last week had some changes in booster shot eligibility from the FDA and CDC. So boosters are now available for everyone 12 and up. And the interval has been reduced from 6 months to 5. So 5 months after your second shot, you can come out and get a booster shot. The booster doses for those under 18 are only Pfizer. That's the only product approved for that age group. But for 18 and up, either Pfizer or Moderna is appropriate. And then testing, remains super important. Last week in the metro area, we had over 34,000 tests done in Jefferson County in the last 7 days. And so with many of those being done in urgent cares and emergency room settings, it's really great to have an off-site independent location like this one. So if you have milder symptoms or you are getting tested to guide your activities, such as visiting with family or other activities, it's really a great idea to get tested at a place like this rather than waiting for many hours and taking up space in an urgent care or an emergency room setting. We're trying to reserve that space for those who are in need of urgent medical care. So 34,000 PCR tests is a lot, so we're glad to have a site like this that can relieve a little bit of that burden, and we're looking to hopefully have some other probably smaller sites coming online in the coming days and weeks as well. And I think that is the update. So just encourage people to get boosted if you haven't, get tested. If you have symptoms, please stay home and isolate until you can confirm that you are negative. And otherwise, wearing your mask indoors and around anyone who is at particularly higher risk. Get your boosters. They're available at 100 places in the Jefferson County area, and that's all we have for today. Thanks.
Any questions for Dr. Hartledge? Okay. Any other questions regarding to testing?
So Dina gave us the buzzword there, which is that the PCR is considered the gold standard. It is the most accurate test, not only for the Omicron variant, but for really any viral testing. The antigen test has a lower sensitivity with the Omicron variant. It is still fairly specific. What that means is if you get a positive test on your antigen test, that you can feel pretty confident in believing that that's a true positive. If you get a negative on your antigen test, especially if it's early on in the potential infection, that you may consider repeating that test in a couple of days or seeking a PCR test to confirm, because you may receive a false negative with the Omicron variant. That's the data out of the FDA. So the big advantage to the antigen test is that it's immediate. So within about 10 minutes, you have your result. So for programs like Test to Stay in schools, where you have to have a result immediately, you can't wait 2 to 3 days. That's the biggest advantage to the antigen testing. And like I said, if you do have symptoms and a positive from the antigen test, absolutely that's a real positive. If you are testing and you have the ability to wait that 24 to 72 hours, depending on the lab, for turnaround time, PCR is generally the recommended test, and the antigen tests are in relatively short supply, not only locally but worldwide right now with the supply chain issues that they're facing.
All right, well, thank you, Dina, and thank you, Dr. Hartledge. Appreciate that. Appreciate the media covering all this as well. Obviously, we're wanting to get the message out to everybody. Okay, I want to make a little statement on the in-custody death that I mentioned. On Sunday, January 9th, an inmate was found unresponsive in Metro Corrections on the medical floor. Personnel immediately started life-saving efforts. The inmate was transported to University Hospital, where unfortunately he passed. The inmate was a 66-year-old male who was booked into corrections on January the 5th. This is the fifth inmate that has died within 6 weeks. So this is very concerning. All cases are being investigated by LMPD's Public Integrity Unit. One case is being investigated by the FBI. We've initiated these upon the deaths when they occurred. I've asked LMPD to accelerate their investigations, and if we determine there's any type of pattern to these recent deaths, we certainly will open further investigations. It's been well communicated that corrections has been experiencing staffing shortages due to COVID-19. I want to accentuate that this most recent death happened in a medical housing unit where staffing is prioritized in the medical wing. This unit was adequately staffed with corrections officers and medical professionals at the time of the inmate's death. We've been in the process also of pushing for increased wages at corrections with a new side letter. Discussions were ongoing last week and over the weekend, and we expect the union to vote later this week. We're also in conversations with WellPath. WellPath is the jail's medical provider, and we're talking to them about a new contract that will devote additional resources to health and wellness services at the jail. So obviously we take this very seriously, and we offer our condolences to the families of all of the deceased. Any questions? You know, there's been 5 deaths, right? And they all have different circumstances behind them. The numbers show us that we average about a little over 3 deaths a year at the jail. I wish it was 0, but when you go back the last 15 years, it's about 3. So the question is, is something unusual happening right now, or is this just really tragic timing that's coming here? But the actions that we've taken at the jail have been numerous. We've been working with the jail, with the state, which we hold inmates with the state, and oftentimes we're pushing the state to take those inmates on time, and frequently they don't. So we've had a very good cooperation with the state. So as of late last week, we reduced the inmate population from 1,665 to 1,412. So the state's over 45-day population is the lowest where it has been. That's important because we have about 50 folks that are out related to COVID. So the lower our population can be, the better it is in terms of spreading that over our personnel. We've also been trying to increase people coming to work at Metro Corrections. We've dedicated about $6,500 of retention incentives and premium pay to our sworn corrections officers, and an additional $500 for folks who will be vaccinated. And then we set aside $12 million to increase wages within Metro government, and part of that would be going to the Metro Corrections as well. And then, of course, we're negotiating this contract with them, which we hope they'll be voting on this week. And then inside the jail, we've been on the forefront of keeping inmates safe with vaccines. So I hope people see how seriously we take this, and a lot of actions are going on. So as we get more information here, we certainly will act accordingly.
Mayor, are you considering when would you consider an outside review or outside audit of the operation?
I asked LMPD today to let me know when they would have some conclusions that we could act upon. So I asked them to obviously accelerate the professional integrity unit. So I'll have some more information on that later today.
So after LMPD concludes its investigation, will they make a decision on whether an outside entity outside of Metro government should be reviewing operations?
Yes. Yeah, we want to see if there's any kind of patterns at all.
Would be a pattern of practice type of investigation like we're seeing happen at LMPD?
Well, that's a federal definition, as you know, from the Department of Justice. And I mean, if there's anything to suggest that, we're going to involve the feds. We've already done that with one investigation where we asked the FBI to get involved in one of the suicides.
We see some similarities here, right? So no confidence vote for leadership and some unfortunate cases of outside eyes and calls to remove the director, just like there were calls to remove Chief Conway, and then we got to a situation with ended up with Breonna Taylor community. We had a ripple effect in the community. Is that going to happen in the jail before we see a serious reform?
I think you're just kind of weaving a couple things together and drawing your own conclusion there. What we're going to do is follow the facts, and let's see what the facts show us, and then we'll take the next step from there. What I hope to get from them is some timeline on when the cases will be concluded. Okay, well, thank you all for coming out, and stay warm. All right.